All right, part E, psychotherapeutic agents. Now we're moving beyond sleep into actually mental and emotional disorders. Most commonly, affective or mood disorders, anxiety, and psychoses. Affective disorders, these are normal human emotions. Anxiety, grief, depression. We all feel these. We do. We're humans. We all feel anxious at times. We all have grief. And we all just feel down, depressed. But most people are able to work through it. Some people can't. And actually, it's a fairly large number of people that need assistance of some sort to get through these normal conditions. Anxiety disorders. Anxiety is an unpleasant feeling. We've all felt it. I mean, you may feel it every time you come to school because you're students. That's just a possibility. It's a feeling of apprehension or nervousness caused by the perceptions of a potential or actual danger that threatens a person's security. So if you're worried about passing classes, if you're worried about confronting a boyfriend, girlfriend, if you're worried about paying your bills, that can cause anxiety. And again, that's normal human emotions. An anxiety disorder is when it's abnormal or an irrational response to stressful situations that impair normal daily functioning. So we all can feel anxious, but when it prevents you from functioning, then it becomes a disorder. This is the most commonly encountered mental disorder in clinical practice. 16% of the general population will experience an anxiety disorder during their lifetime, and it is more common in women than men. It may be based on an actual anticipated experience or past experience. It may be exaggerated responses to imaginary negative situations. Areas of the brain that have been identified as focus of anxiety disorders include the limbic system and the central cortex. The neurotransmitters include norepinephrine, serotonin, and GABA. So what are some of the major anxiety disorders? Well, there's generalized anxiety disorder, GAD or GAD, panic disorders, phobias. Now there are simple phobias and social phobias, post-traumatic stress disorder, and obsessive-compulsive disorders. Tension, fear, difficulty concentrating, apprehension are some of the emotional feelings. Some of the physical feelings and symptoms could be tachycardia, palpitations, tremors, sweating, GI upset. And I'm willing to bet everybody in this room has felt that way probably at least once in March, this month. But did we let it control our lives? That's the thing. If you feel anxious and you work through it, great. If you feel anxious and it controls you, that's when it becomes a disorder and we may need some help. Anxiety is also a primary symptom of many other psychiatric disorders such as schizophrenia, mania, depression, dementia, and substance abuse. So a person could be anxious but not have an anxiety disorder. That anxiety could be a symptom for something else. So it's a complex condition. Common nursing diagnoses that you will work with when you're working with a person with an anxiety disorder, obviously anxiety, confusion and fear, hopelessness, risk for injury, powerlessness. People that have profound anxiety disorders feel that they have no control over their life. They're powerless. Altered role performance, social isolation, altered thought processes, and altered family processes. It's a powerful condition. And the problem is it's so common in varying levels that it's sometimes easy to overlook or to minimize. So we're going to be talking about anxiolytics. Anxiolytics, anxious or anxiety, lytics are to break. So these are medications that break anxiety. and they're best are used when when anxiety interferes with daily functioning. Some of the anxiolytics are shown to work best for panic disorders, where others work best for general anxiety disorders. The desired outcome is to control anxiety-related symptoms and help the person to achieve normal ability to function. It works best when there's also some therapy involved, because many often, we talked about some of the feelings and some of the causes. They're not all chemical related. A lot of them are external forces upon us and how we react to those external forces. So talking with somebody is a very important part of this, but the medication is also a factor. All of these agents will reduce anxiety by reducing overactivity in the CNS. Benzodiazepines depress activity in the brainstem and the limbic system. Antihistamines depress CNS by simple sedation. Barbiturates are no longer used for long-term treatments of anxiety due to the side effects and interactions that we talked about in Part C, sorry. And azaspirones are non-sedating and non-habit forming. So in the next section, I'm going to talk about some of the medications. This is just an overview of anxiety and its pervasive nature in so much of our society and in so many of the patients we'll be dealing with. Even people who have never been anxious before, if they're in a hospital, they very likely have risk for anxiety at the very least, if not full-blown anxiety, while they're in the hospital. I mean, imagine a person who's waiting the test results of a possible tumor. Do you think they're anxious? Do they feel powerless? Do they feel hopeless? Fear? Confusion? So, an important condition to think about and to keep in the back of your mind as always being a possibility of something we need to address. All right, come back for us to talk about specific medications.